The news is good. Yes, mental illness is common. It's even gotten more common. That's not good news. The good news is what goes up can come down. It's always treatable. It's usually curable. It's even preventable. And we actually know something about how to do that. So join us. Come into our space, and we'll do it together.
When Bertie made her gift to us, we talked a lot about naming the program, and I thought we would name it by like Elliott Program or something along those lines. And Bertie was quite adamant. She did not want her name on the program. She really had a very specific idea that she wanted this program named Ohana to really reflect the concept of family in its broadest sense.
So Ohana is a center where families can turn when they're concerned about their child to easily access high quality evaluation that they can trust is accurate and have access to evidence-based treatment delivered by multidisciplinary teams that keeps family at the center of care. In addition, Ohana is more than that. We're now a space that is a resource for the whole community to be able to learn how best to build mental fitness, how to preserve mental health, how to expand it, how to support people you're concerned about, either children, teenagers, or adults. And we're a partner to all of those organizations in our community that have already been doing that work, and hopefully an organizer and a connector. So that all those things together mean we're really a resource for every family in the community.
Hi, my name is Molly Hansen and I'm a therapist at Ohana on our prevention team. And our main goal here is to help build in some mental fitness skills to our youth so that hopefully they don't have to come to our building. Hopefully they have these skills kind of built in, whether they're learning them at school, whether they're learning them here at the Equine Healing Collaborative, working with horses. We're really excited to be here today as a part of Camp Ohana.
For our students, 65% of our students qualify for free and reduced lunch. They don't necessarily have a lot of extra means to get outside support. So integrating the support into the school day is really imperative for them and their families in order to get the support that they need.
Having Ohana's presence in our schools on a daily, weekly, consistent basis has directly impacted my students' ability to take on new challenges, to problem solve, to have relationships with other students. I see growth in my own children because of their experiences with Ohana.
Today I just want to say that I'm really thankful for this opportunity to be able to talk to these kids about mental health and the fact that I've gone through stuff as well. It really makes me happy that they have the opportunity at such a young age to have somebody to talk to. I hope, I can be a part of something like this again.
They look to our players as role models, and some of our players have similar backgrounds to some of the kids that they're training. So it's kind of a natural fit.
Hope will become an important part of our whole culture. The entire county will have hope for their future. Part of the impact will be the role modeling that we're able to do to show the importance of the preventive programs that we have in place.
When we're seeking care, we're coming from a place of fear, maybe despair, maybe some hopelessness. And I want families to feel that they belong and that we're here for them, and that our partnership is really going to spark possibility. And that's where hope is.
Intentional design of putting family at the center and thinking about family holistic treatment and approach to, let's say, adolescent crisis as a whole family crisis.
What I'm just so excited for is the emphasis on evidence-based treatment, of being able to get in quickly with our patients, treat them effectively, and then get them moving on, letting them know that treatment doesn't have to be lifelong if it's not needed, providing the family the hope and the resources that they need to provide effective treatment. It's truly exciting to be a part of.
We hired Susan Swick 5 years ago, and she's been quite busy building a team of clinicians. We have well over 60 clinicians now on the team, whether it's child and adolescent psychiatrists or social workers, marriage and family therapists, family caseworkers. We have a very robust and diverse team who last year provided over 20,000 patient encounters to our community.
Every day that someone has an assessment, we have a meeting where we staff and talk with all the people who did assessments that day, plus myself, plus the medical director, plus the manager of the assessment program. And we will try and make sure that we got the diagnosis right, that we got the treatment group right, that we're thinking about what kinds of ways we can layer treatment so you get treatment as soon as possible, as early as possible.
So at Ohana, we have the opportunity to grow our own, starting with our interns, transitioning on to associate level clinicians, to licensed clinicians, and then hopefully really supporting them in building their skills to become senior clinicians.
After I become licensed, I do want to stay here at Ohana and continue to develop as a professional. One of the biggest sort of compliments that I can give Ohana is I feel like I've developed more as a professional than I possibly could have at my previous places of work.
The opening of this campus, I think it makes a statement. First of all, it's stunning architecture, mindfully designed to create an environment that says this is not something that we hide.
Start with words, have that be translated into physical spaces, inside, outside, nature spaces, as well as man-made spaces, art, music. So nonverbal manifestations of feelings, of ideas, of thoughts in a way that actually really is going to make our work easier. Because when a building makes you feel a certain way or a piece of art makes you think something, it gives you a chance to stop and notice that, or notice it with a family member, a friend, a colleague, a therapist, a doctor. And for some, it will really catalyze richer verbal work, so the work of maybe psychotherapy. For others, it will be the work. For some, that verbal work is harder. It's not only a crystallization of our ideas, it's a whole new set of tools for us. It's more than I had hoped for. The depths of my appreciation for Birdie first, and for all the other members of the community that have stepped forward to ask questions, to learn more, to understand, and then to be involved.
It's once in a lifetime that something like that happens, and it could be truly revolutionary or groundbreaking. And if you invite right people, like Dr. Swick, to lead that kind of vision, then it's full of possibilities.